Good evening. Welcome, everyone. Thank you for joining us today for Organon Masterclass 2025, hosted by Homeopathy 360. I am Dr. Noori, Senior Editor at BGen. It is with great pleasure that I welcome our esteemed speaker of the day, a distinguished homeopath renowned for his deep understanding and practical application of classical homeopathic principles, an experienced academician and administrator with over 35 years in homeopathy, specializing in organon of medicine, Dr. Bibhu Prasad Panda. Sir is currently serving as professor and HOD at Rajkot Homeopathic Medical College, Gujarat. He holds a PhD and has been into leadership roles at various homeopathic colleges. He has been a member in academic councils across several universities. Sir has also published several publications under his name on topics like immunology, constitutional prescribing, computer vision syndrome, and holistic health, and has presented at various national seminars. He was also a delegate at Liga Conference in 2011 and is also an esteemed contributor of the book Spirit of the Organon by Dr. T.C. Mandal. In today's webinar, Sir will talk about correlating accessory circumstances with fundamental cause. Sir, we are absolutely delighted to have you with us today.
Thank you, Nuri madam. Am I audible?
Yes, sir, you are absolutely audible.
So first of all, I would like to thank the team of 3C Home 360 BJN Publishers for giving me chance to share my views about the accessory circumstances in the master class. And really, it is a good initiative that has been taken by your team, and I definitely it will help our students as well as the teachers or faculty members, by which they can share, we can discuss about the difficulties and we can share the views about the Organon of Medicine, the new book published by Dr. Tapan Chandra Mandal in this year recently. So let me share my slide, PPT.
Yes, sir. So while sir is sharing his PPT, a quick note for the audience. If you have any questions, please drop them in the Q&A box and we'll try to take them in the end. The stage is all yours, sir.
Is it visible?
Yes, sir, we can see that.
So good evening to all. Actually, I am a reviewer of Spirit of the Organon, a treatise of Organon of Medicine written by Dr. Tapan Chandra Mandal. So the topic which is allotted to me, that is correlating accessory circumstances with fundamental cause. So which is written in aphorism number 5, but it is very negligible by the practitioners as well as the teachers as well as the students. That's why I think that I should give my view about the role of accessory circumstances in day-to-day practice as well as in clinical point of view. So let me go ahead. So we'll discuss the topic. These are the points: definition, ascertainable physical constitution, the moral and intellectual character, his occupation, mode of living, social and domestic life, his age, his sexual function. And in different aphorism, Dr. Hahnemann has mentioned nicely the importance of accessory circumstances in the field of treatment, especially in chronic diseases. So he has mentioned mainly in aphorism number 5, though he has not written the name accessory circumstances in aphorism number 5, it has been mentioned in aphorism number 7. But he has written all these 8 points in aphorism number 5. And again in aphorism number 94, aphorism number 204, 208, and footnote number 81. So one after one we'll discuss, and we'll discuss about the importance of this. So now let us come to the word meaning of accessory circumstances. The word meaning, dictionary meaning of accessory, that is additional circumstances and factors. So these are the additional factors which play a vital role in the disease maintenance and even creation, and even it produced obstacle in the path of cure. Though we are selecting a good minimum, but it creates obstacles. these are the circumstantial factors. These are the additional factors or circumstances which are very essential to find out the chronic miasm, and sound attention should be paid to elicit the cause of chronic diseases. Now let me describe about the spirit of the organon written by Dr. Tapan Chandra Mandal. Recently it was published a nice book, and he had collected so many things, compiled so many things from different philosophy, different articles, that is scopus articles. And what I'm thinking, such compilation you will rarely find in any book. I am giving some examples, and it is published by Bijan Publishers, and entirely it is framed out considering the CBDC syllabus, is competency-based dynamic curriculum syllabus, which has been implemented by the National Commission of Homeopathy following the NEP, National Education Policy. So this is the what I am telling, that is the correlation between different subjects, and Dr. Tapan Mandal has compiled it in nice manner, though he has published so many books in organ medicine, but this book is something different. And this topic, accessory circumstances, has been mentioned in chapter number 12. Definitely, I will request all of you to purchase this book, that is Spirit of the Organon, a treatise on organon of medicine. So it will be very helpful for to teach the first year subjects, to make acquainted to the first year students how to write, how to give answer, in which way we have to give the answer. Everything has been mentioned in page number 308. So what he has mentioned, a proper understanding of accessory circumstances will help us to find out the proper fundamental cause in a case, which in turn helps in curative treatment. So if we will not consider, we have no knowledge about accessory circumstances, then we are not able to find out the fundamental cause, which is the prima causa morbi, which is the primary cause of the disease, which are chronic miasm. We can't able to find out or identify that which miasm is playing role behind this disease. So it is very essential. Again, I want to share something about the causes of the disease. Root cause analysis has been written, you must have seen. So in each and every book, even in Organon of Medicine 6th edition, translated by Aridajan, Dr. Hahnemann has mentioned that the knowledge of accessory circumstances is very essential to find out the fundamental causes. And the other causes, what has been written, that is exciting cause and maintaining cause. So as you know, exciting cause is the cause of acute diseases. But how Dr. Tapan Chandra Mandal has been written, I am just telling to you. So in each and every book, it has been written that the acute disease, the exciting cause is responsible. It excites the latent sora explodes, then acute disease occurs. But here he has precisely mentioned that what is the exciting cause behind your individual type of acute disease, what are the exciting cause behind sporadic disease, what are the exciting cause behind epidemic disease. For example, the individual variety of individual variety of acute disease are caused by individual variety of exciting cause, like wetting in rain, exposure to northwest wind, exposure to cold. And when this exciting cause irritate the latent sora, dormant sora, sleeping sora, the latent sora, dormant sora, it explodes, and sudden array of symptoms comes, which constitute your individual variety of acute disease. And that the role of individual variety of exciting cause will not play in case of sporadic disease. In case of sporadic disease, the exciting cause are telluric and metoric. So telluric and metoric are the causes. So these exciting cause, what I am telling, that it affect several person here and there due to the cause is same. So you can treat it by following the principle of genus epidemicus, like epidemic diseases. So here what I am telling, the susceptibility which plays role, that is a common susceptibility, which is because of that several person of that particular locality are suffering. Same thing, the exciting cause in case of epidemic disease is something different. As Tapan Chandra Mandal has mentioned, that in case of epidemic disease, the causes are inundation and calamities of war. They are the exciting cause. Of course, the miasmatic cause is what is called, that is acute miasm. Acute miasm again divided into two parts. Number one, that is your fixed miasm or non-recurring miasm. Second one is recurring miasm. So they produce different type of epidemic disease, either reoccurs or does not recur or occur once in a lifetime. So precisely he has mentioned. Again, exciting cause is not the cause of acute disease exclusively. So it is responsible to produce acute exacerbation of chronic disease, acute episodic attack of chronic disease, acute disease appear during chronic treatment. So these are the things he has collected, compiled from the philosophy of Davlesar and other books. So we need to consider these things also. So one after another he has mentioned clearly that when a patient you are treating, for example, he is suffering from asthma, you have prescribed a medicine arsenic, and what happens because of cold air, because of drought of air, the condition may aggravate. That is acute exacerbation of chronic disease. So how will you manage that case? First, you have to deal with the acute conditions, then you have to go to your miasmatic medicines. Acute episodic attack of chronic disease. For example, a person is suffering from epilepsy. You have prescribed the medicine for epilepsy, that is Cipro metallicum. So what happens during episodic attack? You have to think about acute medicine, and the episodic attack, when it is over, then again you have to go to your chronic anti-miasmatic medicine or constitutional medicine. So these things has been clearly mentioned that if you will not find the cause and remove the proper cause, and if the cause is persist, then automatically the effect will be there, or it will lead to palliation or suppression. So in homeopathy, as we know, that we have to consider the cause, not the effect. We have to consider the process, not the product. We have to consider the beginning, not the end. We have to consider the world of thought, not the world of matter. So these things have been mentioned clearly, precisely by Tapan Chandra Mandal, not only in the chapter number 12. In every chapter, he has written in a separate manner. We can teach, that teaching will be micro teaching. Now, what CBDC pattern wants. So even in every chapter, he has written a question. He has given the questions. What type of question you will get in this chapter, micro as well as macro. So everything has been mentioned nicely. And about accessory circumstances, we have already mentioned that without the knowledge of accessory circumstances, you cannot able to find out the fundamental cause. Then next, we should come to the point regarding accessory circumstances. So all the genius, the students, the faculty member, they should know that there is a relationship between the accessory circumstances and epigenetics. The epigenetics is the study of heritable changes in gene expression that occur without altering the underlying DNA sequence. Essentially, it explores how factors like environment and behavior can influence gene activity. So this was included, I will show you, in 1942. Before so many years, Hahnemann has already mentioned that we have to find out the environmental, we have to consider the environmental factors, we have to consider the behavior, and we have to remove those things because they may play the role of obstacle in the path of cure. This is the things afterwards the scientist has mentioned, and you may go through the article that has been published by Calcutta Homeopathic Medical College journal. The article has been written by Dr. Fatma Jeha in 2022. So the topic is accessory circumstances and its importance in the light of epigenetics. So epigenetics means the effect of behavior, the effect of environment in genes, and it also explores the activities of gene, though it cannot change the gene, but it can modify. So this can be correlated. So epigenetics and accessory circumstances. The term epigenetics was introduced in 1942 by embryologist Conrad Waddington, who, relating to the 17th century concept of epigenesis, defined it as the complex of developmental process between the genotype and phenotype. So there is scientific reason that the behavior, the environment, it also affect our genetic exploration. So we should have thorough knowledge about accessory circumstances. Then, so this is not visible clearly that what about the epigenetics and the behavior pattern, it affect the gene of a child. I have collected from the nets, so it is not visible. That's why I am going ahead. So now let us discuss about accessory circumstances. We know man is inseparable from his environment, is continuous process of adaptation. From the beginning, after our birth, we are adapting our environment. So if we are adjusting well, then there is no problem. We are maintaining healthy life. If we fail to adapt, then we are suffering from disease. So environmental knowledge is very essential, and that plays the etiology of disease. So the disease may from inside, may from outside. So inside, if there will be any defect in coordination between the trinity of life, that is soul, that is body, mind. So our vital force, it maintain harmonious between the trinity. If the trinity will be disturbed, as it has been mentioned in community medicine, host, agent, and environment. So when there will be disturbance between the triad, then what happens there? It is expressed outwardly by means of abnormal signs and symptoms. Those combination is called disease. So outside, that is environment, our living style, etc. I will discuss later on. So the ascertainable physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relation, his age and his sexual function. These are all accessory circumstances which helps us to find the fundamental cause. What are fundamental cause? That is miasmatic cause, they are psora, syphilis, psychosis. How these accessory circumstances helps us to find out the fundamental cause, we'll discuss one after another. And if you have knowledge, then you can easily find out the accessory, the miasm. As for example, we know about the germ, about the what I am telling, developmental evolution, that is ectoderm, mesoderm, and endoderm. So we can find out the miasm behind the disease. If it develops from ectoderm, then the affinity, that is psora. That means ectodermal organs, ectodermal cells, they are having a susceptibility or affinity to affect by soric organ or soric miasm. Soric miasm always choose the superficial organs, the epidermis. Then same thing, the mesoderm, that is syphilis, then the endoderm, that is psychosis. So this knowledge, that is inside. So those organs like skin, if there will be any problem of skin, the vital miasm, that is psora. So one after another we'll discuss. So these things are diet, clothing, fresh air, pure water, housing, neighbor, economic condition, exercise, ignorance, superstition, religious belief, attitude, hobbies, interest, etc. Then role of accessory circumstances. What accessory circumstances plays the role in creation of disease or create hindrance in the path of cure. Number one, as a producer and a modifier of the disease. So accessory circumstances can play the role of producer of a disease. Example, circumstances in those who are working in industry. So what happens there? Because of continuous exposure towards the dust, towards the silicon, they may, then what happens there? That act as a exciting cause, that act as a maintaining cause. So it excites the sora, then the person may suffering from silicosis. So silicosis, asbestosis, these are some occupational diseases. The contact dermatitis. So these are some occupational disorders that they are produced by accessory circumstances itself. Suppose a person is come in contact with the dyes, then without wearing any type of gloves, then it will come contact with the skin and it will produce contact dermatitis. So accessory circumstances may produce diseases and may modify the disease. If a person is suffering from any disease, then it may act as a modifier factor, that means modality. The condition may aggravate by accessory circumstances. Even not only physical but mental also. We have studied in different medicines that the complaint aggravates while thinking about it. The medicines are calcareous oxalic acid. So that is the circumstances. When you think, then it aggravates. Complaints ameliorate when thinking about it. The medicine is camphor. So these are modifying factors. So light, music, tarantula, aconite, natrum, sulf. So many medicines are there where the accessory circumstances modify the condition. It also play the role of maintaining cause. As for example, as an obstacle, as mentioned by H.A. Robert in the chapter Deflected Current. So what it does, if you are living in a smoky area, if you are living in a damp area, and you are suffering from rheumatic arthritis, rheumatism, then only medicine cannot help. You have to elicit, you have to remove the place, or you have to remove the obstacle to cure the patient. Because if you are living in a damp area, damp basement, that damp basement will hinder the action of your medicines. Those who are suffering from any lungs disease, if they are living in a smoky area, then that smoke, that environment will increase the condition. Not only physical, you come to the mental also. So many psychic disorders. Yeah, we have studied in mental diseases between the aphorism 210 to 230. So the circumstances, fear, anxiety, reserve displeasure, disappointment, or love, so they are the sole cause of mental, they are the cause to create mental disease. We all know that mental diseases are one-sided diseases, soric in origin, and they affect the mind and disposition. The physical symptoms are obscure. So these things, they played as a maintaining cause. Then a therapeutic hints and choice of remedy. I am giving example. The knowledge of accessory circumstances helps you to choose the remedy. For example, the pollen allergy. For pollen allergy, pothos is the medicine. We have studied. So when the green allergy or pollen allergy is there, then the medicine is pothos directly. Therapeutic medicine, therapeutic hints also you can get by the knowledge of accessory circumstances. Those who are debauchers, those who are said maintaining habit, disturbed life, those who are having no regulation in lifestyle, then Nux vomica is the medicine we all know. So these things helps us to find out the medicine also. Then you come to the next point. It helps us to investigate fundamental causes. We'll read in next slides. So how accessory circumstances, the knowledge of accessory circumstances helps to find out the fundamental cause. We'll discuss afterwards. So accessory circumstances has not mentioned in fifth aphorism only. Accessory circumstances has been mentioned in other aphorisms like 94 aphorisms in case taking. 94. So 94, in 94 aphorism, Dr. Hahnemann has written that you have to consider particular circumstances like ordinary occupation, mode of living and diet, domestic situation. These things, they play the role of maintaining cause. You must have to consider, and you should know that how the mode of living and diet, those persons who have having the habit of sedentary life, want of exercise, they suffer from disease. So that is environmental factor. They are the accessory circumstances. So that accessory circumstances must have to find out, and that's hard to remove to establish a radical cure. Ordinary occupation, those are working in stitching industry. So because of eye strain, they suffer from certain diseases like eye pain, neuralgic headache, arsenicum, nitricum, ruta, they are the medicines. So this knowledge helps us to find out the medicine also. Then you come to the next point. In 208, aphorism, Dr. Hahnemann had mentioned that factors increases the malady, favor or hinder the treatment in chronic diseases. These accessory circumstances, these are the factors increase the malady. That means it is one of the modifying factors, that it is one of the modality where the condition of existing disease increases. Example he has given, and that is the age of the patient. So the age of the patient is one of the factors where the immunity becomes down, the susceptibility becomes low. So definitely the person adapt the medicinal power slightly late than the young person whose susceptibility is high. So again, we have to select potency accordingly. As you know, susceptibility is directly related to the potency selection. So when you select medicine for an aged person, the potency must be low. Or if you are selecting medicine for young person, then the potency must be high. Again, we should have that knowledge. Again, environmental factors I am telling. So potency directly proportional to age, but there is a contradiction in developing stage. Though the age is more, the susceptibility will be more. For example, a baby of 5 years and a baby of 12 years, when the menses commence, so at that time the susceptibility is high, you have to select higher potency. So these things must be considered. Another thing, mental fear, you take mental fear like bad effect of insult. Insult is nothing, that is environmental factor. So when a person is insulted by someone else, then what happens there? The person suffer from certain diseases, insomnia. Then he may suffer from severe headache. He may suffer from depression. So the medicine is staphysagria griva. We all know. So that is also environmental factors. So you have to remove it. If he is being insulted, then you have to find out the root cause. Then you have to give the medicine. Then the patient can be cured, radical cure established. So then his mode of living and diet, of course, the person who is suffering from certain diseases, the diet plays a vital role. Even Hahnemann has written, you have to maintain proper diet, because what happens there, if you will not maintain proper diet or regimen, then it may causes the aggravation of the conditions. Diet and regimen during drug proving and diet and regimen during treatment. In 125 footnote, Hahnemann has written about the diet and regimen during drug proving. Because when you will prove medicine, then the diet should not contain any type of medicinal ingredient. If it contains, then it may hinder the action. That's why Dr. Hahnemann has written, in a darkest coolest night, the tune of a flute is better audible than daytime, because of the sounds of other persons. So there should not be any type of hindrance. That hindrance is nothing, that is accessory circumstances. So you have to remove the circumstantial factor. That may diet, that may be mode of living. Then occupation. Yes, so many occupational hazards are there. So if occupation plays a role of maintaining cause. If it will not improve the occupation, then our homeopathic medicine cannot do anything. That's why even in intermittent fever, the fourth variety which prevails in Marsi district, endemic in nature, you can't cure if the person is residing there, maintaining well diet and regimen. That person should be shifted to a mountainous region, and series of antiseptic medicine need to be prescribed. So occupation, domestic position also plays a major role. So if you will not counsel the patient, then and you are prescribing the medicine, it is useless. I am giving one example. Follow Boric Medica. In Boric Medica, it has been written that the causes is financial ruin, financial problems. Calcarea pos is the medicine. Sorry, calcarea floor is the medicine. So calcarea floor, if the person is always thinking about the financial ruin, and you are giving other medicines without considering the fact, accessory circumstances, it cannot be possible to cure the patient. So the domestic position, how the person is adjusting with the situation. Even World Health Organization has clearly mentioned the definition of health. It is a complete state of physical, mental, social well-being, not merely absence of disease or infirmity. So socially, the person must be well adjusted. If the person is not well adjusted with the society, then your medicine will not work. You may select a good simillimum, but that simillimum will not work if the person gets some stress by the domestic position. He is not well adjusted with the family. If there is a odd situation in the family, we have already studied in case of child medicine. The indignant child suffer from diarrhea due to indignation of the mother, due to anger of mother. When the mother will be angry, then the child is suffering from diarrhea. You just see the that domestic position. If so, if you will not counsel the mother that this is one of the cause, then chamomilla is the medicine. Only medicine cannot do anything. So you have to find out the root cause to establish a radical cure. These are nothing. They are environmental factor, indignation, anger of the mother. Yes. Then his social relation. So how the person is adjusting with the society, whether he is well, even in 5 levels of prevention in community medicine. It has been park. Follow the park and park book. The levels of what are the levels of prevention? The first level is health promotion. The second level, that is specific protection. The third level, early diagnosis and treatment. The fourth level, domestic disability limitation. Fifth one is rehabilitation. So here also, it has been mentioned that if you can't able to prevent the diseases, and at least you have to limit the disability. When you limited the disability position, then the society may accept, for example, a person was suffering from leprosy, and you have cured the person, but he has lose some fingers. The society may accept or may not accept. It is our responsibility to counsel the society. We have to prove that he is now free from any type of diseases. You can adapt the person, and you can help him as a family member. So this social relation, if it will continue, then he may suffer from depression, and the depression leads to several type of diseases, mental disorders. So these things must be considered. Then accessory circumstances, what has been written in footnote number 81. These accessory circumstances, they act as a modifying factors and transformation of Sora. Mandala and Mandala has already written in the chapter. Transformation of Sora. We all know that Sora is in latent condition in all living organism. In sleeping condition, in dormant condition. So when these accessory circumstances will irritate the latent sora, then the latent sora explodes and causes acute disease. So and if it will continue, then what happens? It will lead to chronic disease. So this knowledge should be there to elicit sora also. The climate, peculiar physical character of the place, excess or abuse of business or condition of life. Yes, so these things, diet and regimen, passion, manners, habits, and customs of various kinds. So these are the circumstances need to be considered, which has been mentioned by Dr. Hahnemann in footnote number 81. If you will not consider these, then you can't cure the disease, because they may play as a modifying factor, and if the modifying factor has been existed, you can't able to cure it. Then ascertainable physical constitution of the patient, how it helps us to find out the miasm. Constitution, what has been written by Stuart Close, I am telling about Stuart Close philosophy. It is an aggregated hereditary character, more or less influenced by the environment, which determines the individual reaction, successful or unsuccessful by the stress of the environment. So it is completely a stage in which the disease grows. This is the soil in which the disease grows. So everything, it comes under the constitution. That may be diathesis, that may be temperament. That's why it is called the temperament is inner constitution. Diathesis is a predisposition, it is a constitutional state. So if you have no knowledge about constitution, then you can't able to cure, because the constitution plays a role of obstacle also, and somewhere it is needed to prescribe constitutional medicine to remove the blockage. Suppose you are prescribing a good medicine and the medicine works, but again reoccurrence occurs, then you have to give constitutional medicine. Example, yes, child is suffering from fever after hair cutting, you prescribe belladonna, the child gets cured. Again after 2 months, again he came for the same problem. Now you have to prescribe belladonna, because this is acute condition. When the fever subsides, the fever cured, then you have to prescribe the constitutional medicine or complementary medicine, calcarea, to prevent recurrence. So we should have thorough knowledge about the constitution, and I am not telling the classification of constitution of other stalwarts like Leon Venure. I am just telling about the constitution which is classified by von Gravogel. They are carbonitrogenate, hydrogenate, and oxygenate. So constitution is a broad term. So those person who are belongs to carbonitrogenate, what will be the affinity? The affinity of carbonitrogenate persons are towards soric miasm. As I have mentioned here, lycopodium. Lycopodium is a deep acting antisoric medicine. As we have already studied, SCL, sulfur, lycopodium, calcarea, they are deep antisoric medicine. So carbon, nitrogen and constitution, lycopodium, hydrogen and constitution, natron salt, oxygen and constitution, carbobate. So these constitution Hahnemann has mentioned in aphorism number 5. Physical constitution must be considered, because it helps you to find out the miasm. If the person is carbon nitrogen constitution, then the affinity of the person towards sora, the temperament is irritable nervous, the diathesis is scrofulous, the germinal layer, that is ectoderm. So we have to correlate it. So Dr. Mandal has correlated it. So this is called integrated approach. So if you have thorough knowledge about the integrated approach, then you can establish radical cure. Same thing, hydrogen and constitution. The affinity of hydrogen constitutional people is towards the psychotic miasm. Then the psychotic miasm, the temperament is bilious temperament. The diathesis is rheumatic, arthritic diathesis. So everything are interrelated to each other. And when you came to know that the person is hydrogenated constitution, then you can able to know that which miasm plays the dominant role, predominant role here. Then you have to find out the miasm and you can treat the disease accordingly. Likewise, oxygenate carbobase is the medicine. Oxygenate constitutional people are more susceptible to suffer from syphilitic miasmatic disorders. The temperament is melancholic. The diathesis is distractic diathesis. So all are interrelated to each other. If you have having the knowledge of physical constitutions, then that they are the accessory circumstances which helps you to find out the miasm. So we should have thorough knowledge about ascertainable physical constitution of the patient. We should have thorough knowledge about the moral and intellectual character. How the moral and intellectual character helps us to find out, to identify the miasm which plays the role behind it. The moral and intellectual character means virtuous or power to judge or compare between right or wrong by using the intellect of individual of the person. So that is intellectual character. So everybody has having separate intellectual, separate IQ. So that IQ level helps us to find out the miasm also, the fundamental cause also. Example, Nux vomica, sedentary habit, lack of exercise. So is the miasmatic background behind it. I am not telling that one miasm is exclusively play the role, but the predominant miasm, where the habit is sedentary, where there is lack of exercise, like students, we have already studied that Nux vomica is the medicine. Here, the predominant miasm is Sora. Second thing, intellectually keen but physically weak. That is psychotic. If you read the miasmatic phase, what happens in psychotic phase? In psychotic phase, the vital force becomes passive. The disease force becomes active. So, because of passiveness, what happens there? There is slowness of all vital operations, all vital functions like circulation, like respiration. So, when there will be slowness, it leads to infiltrative and proliferative disease. So this knowledge we should have. Likewise, the mentally the patient also very, though the physical the person also very much weak. So lycopodium is the medicine, psychotic miasm is in the background. Likewise, Merxel, if the patient is mentally aggressive, want to destroy himself or herself, then Moxel is the medicine we all know that the king of antisyphilitic medicine. So what happened? The intellectual character, aggressive, syphilitic, intellectual, keen, physical weak, psychotic, sedentary habit, lack of exercise, so on. So here you just see how the accessory circumstances helps to find out the miasm. Then occupation, activity, job or profession. Occupation, that means the activity what you are doing as a farmer, as a laborer, as a bankers. So the diseases also differ from person to person, and the affinity of miasm also different as per the job, profession, activity is concerned. We all know those who are working in milk dairy, where we are prescribing a medicine Dulcamera, that is damp area, damp basement, when the person is living and suffering from any disease. When you take the case history and came to know that he is living in a slum area, then we prescribe Dulcamera. So when the humidity increases, the condition aggravates. That's why psychotic miasm is the predominant miasm. We have to prescribe antipsychotic medicine. So when the weather changes, the antipsychotic medicine is indicated, because of that Phyllis Spirit has given the name, that is barometer miasm. Then you come to glonine. Glonine Working under gaslight, functional disturbance occurs. Soric is the miasm, predominant miasm. We all know that Sora produces all variety of functional diseases. Psychotic and syphilis, they are responsible to produce different type of what I am telling structural changes. Psychotic produces all type of infiltrative and proliferative disorders. Where there is infiltration, there is proliferation, like your fibroid, like your callosities, like your keloid, and uh, infiltration like edema, ascites, etc. So where there is infiltration, where there is proliferation, we should not be confused. The predominant miasm is psychotic miasm. Again, I would like to request, always we have to speak that predominant miasm, because nowadays not even a single patient is completely soric, psychotic or syphilitic. So the miasm sora, the mother of all chronic miasm, is there, but because of the predominancy, we are telling that it is syphilitic predominant patient, it is psychotic predominant patient. Accordingly, we have to treat the case. Then mode of living. So mode of living, that is an accessory circumstances which plays the role of obstacle, which may create disease, which helps us to find out the medicine. Mode of living, the process by which a patient maintains his life for bread and butter, shelter, clothing, education, that is called mode of living. Because you have to live accordingly. For example, a person who is a driver, so regularly he have to drive. So that is the because of to get the bread and butter. So if the person is too dirty, then sulfur is the medicine, soda is the predominant miasm. Too neat and clean, fastidious, arsenic is the medicine. Cosmopolitan mentality, want to change the service, want to change the position, want to change the home, that is tuberculism. So the mode of living helps us to find out the specific remedy, and the mode of living also the creator, the modifier, the maintainer of certain diseases. So when the person comes, he's a react philosopher, then automatically to our mind the sulfur comes. When he's very fastidious, automatically in your mind the arsenic comes. Then you come to social domestic life. Social and domestic life, that means relation between one family, how the person is adjusted with his family. I am giving a good example. That is the example of Sepia. The Sepia lady is indifferent to the nearer and dearer. He has no good relationship, Sepia lady. Nearer, dearer, she scold them. She don't want the presence of the nearer and dearer. So that is the relation which helps us to find out the specific remedy, that is Sepia. If the lady is mild, gentle, yielding disposition, very mixing in nature, the lady gets amelioration by consolation, fear of opposite sex, changeable mood, cannot relate or complain without weeping, then the medicine is your pulsatilla. If there will be consolation aggravates, introvert person, hot patient, then the medicine is not true. I am telling a case which has been described by Dr. M.P. Arya. I was there in 95 to attend a ROTP, teachers training program, which was conducted there at Pune. I used to go to the clinic of Dr. M.P. Arya, which was located there in Nalghar Chowk. A patient came. He is suffering from headache. He is a businessman. His house is at Pune, but usually he has to go to Mumbai for business purpose. So when he was living there, who he is residing at Mumbai, he is suffering from severe migraine. But when he used to come to Pune, the migraine, he is not suffering from any type of migraine. So we, four students, teachers were sitting there. Dr. Ampere told us that you select the medicine, and considering the aggravation and amelioration modality, we select natriumate. Because aggravation from seizure, amelioration from seizure. In Pune there is no seizure, whereas in Mumbai there is seizure. We prescribed natriumate after 7 days. The patient came, there is no change at all. Then what Dr. MP did? He told that now I am taking the case and I am selecting the medicine. He followed the repertory. Select lac caninum. The symptom is headache ameliorated by seminal ejaculation. Headache ameliorated by seminal ejaculation. When he is reciting, he was reciting in Pune with family. He used to do sex with his wife. There was seminal emission, so that's why there was no headache. When he used to go to Mumbai, he suffered from headache because there is no seminal ejaculation. This is the miracle of homeopathy. So relations between own family, environment, accessory, this is accessory circumstances. The circumstances which that person was getting there at Mumbai and getting at Pune is completely different. That is domestic life. And only one single dose of lac caninum 1 mg cured the patient after 7 days. I was there for 1 month. After 7 days, the patient came and he told that I have no problem, though I had gone to Mumbai. So this is the miracle of homeopathic. Then causticum, intense sympathy for the suffering of others. So you just see how the social life, if the person is more empathetic, then you must think about causticum, and if there will be bad relation and this person kills his own brother, then the domestic relationship is not good, then you can think about arson. So this is the role of accessory circumstances, that the environment which gives us or helps us to find out the remedy. Next, we come to the last slide. The length and time that person or thing had existed. So in different age also plays a role, a factor. May play the role of obstacle in the path of cure. The same medicine act in better manner in a young person, whereas the same medicine may not act in proper way in older persons because of the susceptibility. So we have having so many medicines as per age is concerned. Again, age is directly proportional to the potency. So Baratakar, if the patient is older than his age, looking older, then Baratakar is the medicine. So that environment, the looking, helps us to find out the medicine. Old people, a phlegmatic habit, also crotinize the medicine. So it helps us to select the medicine directly. Then sexual function, the activity of reproduction, loss of sexual appetite both in male and female. Unus modium is the syphilis, the miasmatic syphilis. You just see if there will be loss of sexual appetite both in female and male. That is the symptom we are getting during case taking. The predominant miasm is syphilis. The medicine Unus modium. It helps to find out the miasm and medicine. Sexual abuse, medicine is Noxomica psychotic. Impotency, lycopodium, sorry. So in this manner, the accessory circumstances helps us to find out the miasm. Then in conclusion, I would like to request all that we have to correlate the accessory circumstances with the what I told you, the epigenetics. Scientifically, you have to prove that what Hahnemann has written before 250 years, that has been proved by the scientific scientific ground in 1942. So the knowledge of accessory circumstances helps us to find out the cause. Accessory circumstances helps us to remove the obstacles, to remove the maintaining cause, and if we eliminate the accessory circumstances, then our medicine will work efficiently, radically, and establish highest ideal of cure. So these are regarding the accessory circumstances, the touch which has been given to me, and I hope all the audience they will enjoy. And if there will be any questionnaires, then it is rather it will be my pleasure if there will be any questionnaires may be asked.
Thank you so much, sir, for the clarity and practical wisdom you shared with us today in your valuable time. I definitely hope the audience have enjoyed and will also read the book recommended by you. Thank you, audience, for patient listening. And good night, everyone.
Thank you, madam, for giving
Thank
me the chance and share my
our
view.
pleasure.
And
Our pleasure, sir.
yes, madam, let me go out.
Goodbye, everyone.